Protecting your brain is about more than doing cognitive puzzles and Wordle. I'm Colleen. I've been practicing family medicine for 20 years. When we think of the health of our brain, we're often thinking about our memory and how we can maintain sharpness by taking vitamins or doing puzzles. However, our vascular system as well as our sleep are two key components to the health of our brain. The single most effective way that you can prevent strokes is by maintaining a blood pressure below 120/80. That blood pressure has been shown to prevent strokes. It also helps prevent heart attacks. But when we're thinking about our brain health and keeping it healthy, making sure that our blood pressure is adequately below 120 is really vital to help us protect our brain. How can we make sure that our blood pressure is low? Well, first of all, we need to be screening it. We need to be checking on our blood pressure at least once a year in a clinic. If your blood pressure has always run low, that's probably frequent enough. But if your blood pressure has been on that border or within 10 points of 130 milligrams of mercury in that systolic range, you might want to consider checking your blood pressure more often. Another thing we can do that we know is good for our blood pressure is activity. This is where those guidelines come from when they're talking about exercising for 150 minutes of moderate activity every week, or even the strength training of 10 minutes twice a week. This is all related to our vascular health, and our vascular health is protective of our brain when we have good vascular health. Keeping our cholesterol low. Again, it's all about the health of those vessels and the flow of the blood to our brain that helps us maintain good cognition as we age. Other things that you can do are related to your nutrition. So you'll often hear people talking about a low sodium diet or a low salt diet. We know that having a low sodium diet is protective of our cardiovascular system. So it helps, again, protect those vessels. Regardless of whether or not it actually lowers your blood pressure, it's still protective of those vessels. So having a low salt diet is a good idea if you want to protect your brain. That might look like avoiding prepackaged foods because sodium is used as a preservative in those foods, including most of our bread. So just take a look at it so you are aware of how much you're taking in every day. Eating at restaurants is another example of where we are getting more sodium than we typically need. These are broad strokes. I know it's not true for every packaged food and it's not true for every restaurant, but just to be aware of like where we're getting our sodium most frequently is a good way that we can start to think about how we can limit some of our sodium in our diet. So the more that you're cooking at home, the more that you're using fruits and vegetables and whole grains in your diet when you're cooking at home, the lower your sodium is going to be in general. Sleep is also imperative to the health of our brain. We know that sleep deprivation impacts our memory. Some people are thinking that this might be contributing to some of that perimenopausal brain fog that people experience because the drop in the progesterone as well as the hot flashes and the night sweats are impacting our sleep. So therefore our brains feel more fuzzy. But when we're thinking about the brain, we're really thinking about quality sleep, improving our cognitive ability. What does that look like for most people? For most people, it means 7 to 9 hours of sleep every night. And having a rhythm is going to help you establish that 7 to 9 hours of sleep each night. The other question I'm often asking my patients is how often are you getting up to go to the bathroom at night? Because while we'll think about snoring and we'll think about sleep apnea because we know those go hand in hand, not very many people know that if you're getting up frequently to go to the bathroom at night, that can also be a symptom of sleep apnea, especially for women. So if you are getting up to go to the bathroom more than a couple times a night, if you're tired during the day, even though you've been in bed for plenty of hours and feeling like you are asleep for those hours, or you're falling asleep at times that you don't want to be falling asleep during the day, it's worth talking to your provider about getting a sleep study to see if sleep apnea is part of the underlying sleep issue. So this next one gets some people a little revved up when we're talking about regulating our central nervous system. And When I say that, I guess what I'm talking about is like, if something is stressful, are you able to calm down and do normal things through that stressful moment? Because life is stressful. Telling you to get rid of stress in your life is not good advice in general because it's difficult to avoid entirely. But what I want people to be able to do is get out of stress and not be running at a constant high level stress. So, how do you do that? We've talked about singing, humming, anything that kind of stimulates that vagus nerve is going to help settle down your central nervous system. Breathing techniques will help you settle down your central nervous system. That box breathing is another good example of how we can use breathing to help us get out of a stressful reaction. So that's in for 4, hold for 4, out for 4, hold for 4. In for 4. So you see how that box goes with that count of 4. Again, it's just another way to help tell your brain, I don't need you to stay on high alert right now. It is okay. And that's all I mean when I'm talking about regulating your central nervous system. It's that ability to get out of that high stress moment and come to a place of calm where you can do normal things. It'll help bring your blood pressure down. It helps lowers your heart rate. It is an important part of living a healthy life and protecting your brain and your cognitive function. Fiber helps us lower our cholesterol. It helps us manage our blood sugars. It's a good way to kind of keep our system running healthy. And most Americans simply aren't getting enough fiber. We need between 25 and 31 grams of fiber every day. And I've read various studies that have said anywhere from 7 to 10 grams of fiber is typical in the American diet. So add some fruits and vegetables, add some berries like raspberries, blueberries. Think about adding in more whole grains like quinoa, or even adding those chia seeds, having that chia seed pudding. Anything you can do to help increase your fiber is going to be beneficial for your brain because it helps you manage your blood sugars, because it helps manage your cholesterol. Finally, we do use tools to help us make estimates about someone's risk of having a stroke or heart attack. One of the best tools is the Prevent calculator, which you can access on the American Heart Association. To use the Prevent calculator, you will need a few pieces of data to put in there. That's things like how old you are, whether or not you have diabetes, whether or not you're on any medication for cholesterol or blood pressure. You'll need that systolic blood pressure level. You'll need your hemoglobin A1C. You'll need your eGFR, or your estimated glomerular filtration rate. It does ask for your BMI. It asks whether or not you're smoking, and you can also enter in your zip code. And that will push out a number for you. One number is your estimated risk of cardiovascular disease over the next 10 years, and the other number is your risk of cardiovascular disease over the next 30 years. So you can use this tool if you have those data points to kind of see where you're at. So you can take that number, work with your provider to determine whether or not additional medication or changes in your lifestyle would be a good idea at this point to help protect your brain and your cognitive function in the long run. Go ahead and check out our resources. They are on our website, and that link is in the bio.